This is In Touch with Terry, a power-packed podcast for the medical aesthetics industry.
I just discovered your podcast, and I feel like I've hit a gold mine.
This is someone who's got a lot of knowledge. She's been there, done that.
Terry Ross is a former Fortune 500 executive, international speaker, founder and co-CEO of Apex Platform, and Terry Ross Consulting.
Just listening to her energy and her passion and just how hardcore she is.
Her knowledge of the industry and just her connections in general are phenomenal.
In Touch with Terry will bring you solutions to increase operational and employee efficiency and practice profitability. Plus, features some of the top industry experts as guests.
The Apex team literally changed the game for us.
Terry, your courses and your podcast are just so helpful.
She made me feel like I could do this.
3, 2, 1.
Here we go!
Now, here's Terry.
Hello, everyone. How are you? And welcome back to In Touch with Terry. Thank you so much for being with me, for subscribing, and for listening. Thank you so much. I am super jazzed. I have today with me a very good friend of mine, somebody I respect dearly in the industry, Shauna Aiken. She is the U.S. clinical specialist and master trainer for Derma Concepts, which you may know that as Environ. And she is also the owner of the Institute for Advanced Aesthetics. Shauna, hi, honey. How are you?
Hey, excited to be here.
Thank you. I'm super excited to have you. I know that we are on the speaking circuit and we're always at conferences together, and we share so much passion, both for education, and not just the education piece, but obviously from the financial and profitability piece that goes along with that. And we always talk often and again, share these same values, which is what I wanted to have you on this episode today, is that I wanted to focus this episode on talking about the value of retail medicine, retail sales, as it relates to why it's so important to develop a long-term treatment plan. And I thought there's nobody better than to have somebody, again, I love your skin, I love the company, and to really kind of come at it both from the clinical aspect to it and the business aspect to it. So before we even just dive in with all my questions that I think is going to be so valuable for my tribe, listeners, I want you to, and if you've heard me speak, don't cheat because you're going to know the answer. But I want to ask you a question. What % of your business's total revenue should be from retail sales? And this is a big KPI, and it's really important, guys, because one of the things that we want to talk about is that, and we'll dive into this with Shauna, is that retail medicine it's a must, right? It's protecting the investment of your skin or of the procedure. And from a business perspective, it shouldn't be considered an ad hoc. Like if you want to, and you can buy this or maybe buy that. No, it becomes a protocol with that treatment plan. So I'm going to give you the answer. 20% of your revenue should come from retail sales. So write that number down, go back, go to your practice, go do the math and see where you're at. And all it means is you have tremendous room to move and opportunity to grow. And if you are part of our Apex family, obviously that's one of the things we teach in the course, the importance of a treatment plan that only not yields happy patients, but lifetime value and greater patient outcomes. So Shauna, thank you, honey, for being here with me.
So excited.
So tell us a little bit about you before we dive in. Like, what's your background? How did you get into all of this? Tell us really about your skill set.
So I was a professional ballerina before I got into aesthetics. And when I was finishing my undergrad, I decided to go to aesthetics school. And when I got out, I had like a rock star ascend through the industry because I was really dedicated to education. I went all over the world. I worked with some really top plastic surgeons, just relentless in my pursuit. And the thing that I really struggled with was finding something that was really reliable, something that was, always consistent with patients and was easy with compliance. And when I found the right thing and the right information, especially education, the right physiology, biochemistry. And I had that tool. I want to say retail is a tool. It's not separate from your treatment. It is your treatment. And I'll tell you why, because every skin cell is damaged incrementally and cumulatively. That's how we end up with pigmentation, laxity, fine lines, atopy, all the things that people come in for. So if we understand this and we understand that you need to approach it with your procedures, but you need something that's going to address it just like that, incrementally and cumulatively, that is how you achieve results safely and you have lasting results, because that's the only way to change skin truly, is to understand how the damage happens in the first place. And this is something I didn't have access to for a long time in my career, and I have had a really great career. But when I understood how that happens and how it's addressed, it was a home run. And then you have customers forever. I call it Hotel California. Once you get them set up on something that is consistent, that they like to use, that is the right molecules. The skin is very specific to what it needs, primarily vitamin A in usable forms that they'll be compliant with, C and E, and there's other proven things. So knowing this and having this be your first tool, then put the procedures in, that's how I think you're going to be most successful, because they're always going to come back for that. And they're going to rotate through procedures, maybe do a series of Fraxels or do a little this or do a little that. But this consistent tool that they need every day, because light takes these things out of your skin. That's why we need it so badly, because I'm sitting under these terrible lights here. I'm getting deficient. So I didn't understand that or know that. That's why education is so key. And that's why my skin looks this, your skin looks like that, because we know those molecules are getting to where they need to be.
That was amazing. Thank you. I mean, I always learn every time you and I have a conversation and when I'm calling you up for more product. But I want to back it up on a couple of things. For those that are not familiar with DermaConcepts or Environ, I want, Shauna, if you can talk a little bit about the company and not just about the company. Clearly, everybody listening understands there are hundreds, if not thousands, of retail lines to choose from. And I know as a consultant, it's one of the things we get asked about all the time. Terry, what do I buy? What should I get? What lines do you like? And there's different strokes for different folks, guys. And that is not, I'm not a clinical proprietor. From a business perspective, I can tell you things I think work well. But Shauna, if you could really talk about those two things. Number one, who is DermaConcepts? Why are they different than perhaps some of the other lines out there? And then when people are going to choose a line, and you're a clinical provider as well, what are some of the things that they should really consider and think about?
Yes. So basically, how this started was in search for a solution for skin cancer 30 years ago in South Africa. Dr. Des Fernandes, very, very famous plastic surgeon, was looking for a solution for skin cancer. And really, skin cancer is just the worst form of sun damage. So this all started out of a very approach to address patient needs. And he looked out in the world and he knew everybody couldn't use the pharma form because of compliance, because of sun sensitivity, et cetera. So that's how this embarked 30 years ago. It became his baby. And then he's like, this is something the world needs because everybody deals with skin issues, and it's very personal to us. So DermaConcepts is the official distributor of Environ in the U.S. And Environ is a non-branded, I mean, yes, we have a brand, but the education is really about all of Dr. Fernandez's research. And it's sort of a revolution in that type of information, because this is stuff that wasn't out there before. Like, why does your skin change? It's the light exposure that diminishes the cutaneous molecules. Your skin can't take care of itself. So if you replace them, then the skin can start to take care of itself. And then you have all the procedures to boost it along and to kind of accelerate this process. But if you did nothing, this could be a tool too. I mean, if you just had the right retail, the right molecules, just remember molecule is the word. And what they are is A, C, and E, is primarily vitamin A what the skin needs. And then all the other scientific proven things are just frosting on top of the cake.
So I love what you said about, so DermaConcepts then, so I'm clear and everybody understands, is the distributor for in the US. Okay. And why do you think, something you said that I think resonates and will resonate with what I believe and what everybody should believe, is that we're not selling products. We are selling a solution. We're addressing the skin concerns. And I love that. Because obviously nobody in this business should be in it to make money. Certainly, yes, we run a business. We have to be profitable. But at the end of the day, and I'm saying this too, that everything that we choose to bring into our practice, one, has to work. We want it to have clinical benefits. We want to have happy patients, and we want them to return for lifetime value. And I think that because there are hundreds of lines, how do you, as a clinical provider, as an educator across the country, as an esthetician, as somebody who, right, would do the same thing, right? So let's just say you weren't with Derma Concepts. How do you educate people on what lines to choose from?
So knowing a little bit of skin physiology and basic biochemistry is key. And that's one thing that I'm personally working on, is improving that knowledge, because that's not something that even despite the credentials of the provider, that may not be there, because it's still sort of uncharted territory. And that's really what Professor Des brought. But what you need to look for is histologies. Those are the microscopic essays or photographs of what that product does in tissue, not pictures. Pictures can be modified. They can do all kinds of things. They are good references, but histologies are what you want to look for. You can see how the epidermis has been changed. You can see, if the stratum spinosum is thicker. You can see what the dermis looks like. This is the science. We want to look to science-based approaches always. And so that's something that getting that education in there and really making sure that you have a solid foundation is going to help you be able to answer those questions, because they are so confusing. I mean, it's so confusing for practitioners. It takes, a lot of effort and time, but those are some key things: histologies, intention, history, of course, photographs, white papers. And if you know how to read a white paper, because not all white papers are white papers, so it's a little tricky.
What if somebody just doesn't have that level of knowledge or skill or experience, and then you have, I could rattle off, Alastin and SkinCeuticals and SkinMedica and on and on and on, right? We could just go down a rabbit hole of companies that offer good products, right? But, so how would somebody, knowing that, if they didn't have that clinical expertise, make a decision? And what other intangible factors too are important, whether it's the rep, the education, the marketing? What other things should they think about as well?
Yeah, so that is a really, really big question. And it's one that I myself try to think about all the time, because how do people find this? Because I literally was climbing walls and looking for better solutions. And I'm relentless in my pursuit. So when I found it and I saw, okay, well, I can change the epidermis or the dermis without traumatizing, or change the dermis without traumatizing the epidermis, things met. And then I started to see the changes, and then I started getting interested in their education. And I was like, oh my God, this is the missing link. How do we get this out to people? How do they find this? This is my biggest question. And knowing that vitamin A is the most important is a great start. And also directing people to, this is the big question, where you direct them, scientific books that are written on aesthetics, like, well, Dr. Fernandez's book. It's a tricky one. You actually asked me something I'm struggling to get out to the world right now is how to do this. Actually, writing a book is being published in London this summer about this very question. So Congrats. I'm trying.
Congrats. So again, I don't know if we've really kind of hit the nail on the head. If somebody's, because we just launched a new startup medical spa program we're super excited about. And obviously these people have really come to us looking like, what do I buy? What do I get? What should I do? So whether somebody's wanting to add on a new line or again, they're brand new to choose a line, other than the clinical portion of things, are there 3 or 4 points that you're like, look, you should ask the company these 5 things, or these products should do these 5 things, or whatever it is? It could be 10.
Okay. That's so first of all, I'd say the first one is their history and their intention, where they came from, histologies, knowing I would say their partnership, what is their education like? Are they going to dump products and run and you get a 1 hour, talk about it? Because by the way, when you start learning the things that I've learned, it's like the tip of the iceberg. And there is so much, which makes your job so exciting. And your patients, when they see that passion, they see that growth in education, this is what sets you apart from the competition. So although I might have not had the easiest answer, the answer is to look for their papers, really, make sure that your staff is well educated, look to the consultants to find answers because they're out there. They're seeing who's successful, know what the important molecules for the skin are. I mean, if you get a vitamin A baseline, you're going to get pretty darn close. You know what I mean? Because it's non-negotiable. We can't evolve out of what our skin requires, just like vitamin D and calcium for bones. Skin is vitamin A, primarily C and E and some other things. But that is the best advice I can get is know that. Ask for their, scientific papers, ask for their histologies. I would imagine that that's going to narrow your company options down to very few if you ask for histologies. That's my biggest point.
I love that. I'm going to repeat it back because I always want the tribe and the listeners to literally take so many valuable points from this podcast. But, the thing that I asked Shauna was if there was, 4 or 5 things that anybody should look for when they're looking to bring on a new line or add on a line if you're starting your practice. And she said, what is the company's intention? Like, why do they do what they do? I love that. And what she said earlier was that you want to solve a problem and you want to take care of solutions or give the patient solutions. She said intention, ask for histology, which is fascinating. I've never heard anybody quite say it like that. The partnership that you're going to get from the company, the education, and then the rep support. And I really love those 5 things. So Shauna, as this kind of now let's trickle into, we have a line and because you've heard me speak a million times, I am like diehard adamant about a treatment plan, why it matters, how to do it. And obviously from the consulting side of things, I have to help people overcome. I'm not a salesperson and that's not what they asked for and that's not what they can afford, or they're already using enough products at home, but yet they want to get this halo or or microneedling or some expensive treatment, but yet they're not protecting the investment of the skin. And that is such a no-no to me. I'd rather not do it. And I know you believe that as well. What is the value of what we said in the beginning, which is the topic of this conversation? What is the value and the importance of ensuring that retail is part of that plan? It's not optional.
So I can answer that in one question. You're actually not addressing the cause unless you address the cell by cell nutritional needs. That's why, because Halo won't do that. Halo's great, but if you don't address the health of that cell, then you're not actually making real changes. You're actually getting a different kind of tissue. I mean, if you really want to break it down to that, the molecular wound healing cascade is a little different. It'll make your treatment safer. It will give you a better result. It'll give you faster healing. And even if you didn't do the Halo, their skin would change. So it's your first and most foundational tool. It's not an option. I don't treat anybody in my clinic unless they are on what I have them, my recommended. And even if it's just one thing, it's got what they need on a cellular health level. What does that DNA of that cell requires to thrive? And if you don't have that in place, no matter all the things you do, you will never really change the health of that cell. You might use heat, you might use cold, you might do this, you might do that, but it still doesn't change the fact that DNA or that cell does not have what it needs to behave like it did when you were a kid. Kids don't have pigmentation. They don't have wrinkles. They don't have, they may have freckles, but that's different. So this is the thing, is people to understand what they see in their skin is because they are missing those molecules. That is that's the bottom line. So that's why you can't have a practice unless you have that. There's no way. There is absolutely no way. And I could practice without any tools and still have a good practice because of that.
God, do you guys hear her passion? Like, I'm super pumped up. I mean, I'm pumped.
I had like a crazy day.
But I love it because, again, those are innate things that you can't teach somebody. And I love your level of conviction. And you guys, that is what it is.
I saw it.
This is conviction. If you believe that much that what you're doing, what you're prescribing, what you're providing, what you're talking about, you're not selling anything. You guys know what I believe. You're not selling, you're educating the client which is your obligation to do that you
Exactly.
right and now and you've just explained it again on a level that I had no clarity because I'm not a provider what the possibilities are with these cells that we can do again halos and fillers and microneedling and IPLs and Timbuktu. We could go do it all, but if it's not, that's only going to kind of like a Band-Aid approach that what it sounds like you're saying if I'm not treating that cell.
Because if you do an IPL, which I love, by the way, BBL, IPL, and you get that, you bust that melanin out and you take care of blood vessels or whatever, the minute they have stimulus again and that cell connection, the melanocyte and the keratinocyte isn't healed, that communication is off. If you don't heal that, it's going to come right back. I've done that. Somebody spends, $2,500 on a series of IPL and she comes back at the end of the summer and she goes, I didn't realize at the end of the summer, everything would be back. And I'm like, oh, you didn't wear your sunscreen. No, Shauna. It's sunscreen. What about the rest of the things? It was like the whole picture you have to understand. And that's really the piece that we need to help, businesses understand is it's really, really important to understand what the skin needs. We have all these crazy little things out in the industry that some of them are great, but they're never going to replace the basics, the foundation. And that's really just understanding that. And that's non-branded, that's just something that you have to know, that it's important to know where things are packaged, how they're packaged. There's so many details, but if you have the basics right, you're going to be on the right foot.
So let's talk about this. And this is such a sticky thing because every state, as you know, has different laws about who can perform what. Again, I'm in California. It's very strict out here. Estheticians can't do anything, basically. And then, I was just in a plastic surgery practice in Atlanta, and they can. So how do we, I'm curious your opinion. Obviously, I have mine, and there's many ways to skin the cat. So there's no right or wrong, but you're so passionate. And again, your level of expertise, clinical expertise as it relates to skin is probably far greater and vast than most people, unless you've just studied skin or you're a dermatologist or something. But when it comes to the consultation, because again, in most states, you have to be an NP or a PA to do a good faith exam, which could be one thing, and then you can see somebody else. So who do you think should do the consultation when it becomes to skincare? And then my big pet peeve is, how do you keep the continuity of care so that if I saw one person and then I see another, I'm not getting something different whereby the company looks like we're taking a team approach. And that's how I teach, right? We have a team approach and we might have 2 NPs and 2 RNs and 2, PAs and 3 estheticians, whatever it is. And then the client's really like, oh my God, wow, that's amazing. I get all these people. So what are your thoughts on that?
So that's really a great point. And I actually wrote an abstract about that because I do want to talk about that. I think that the person doing the procedures and the treatments, the expert in that particular arena, being at skincare, should be someone like me. How I've seen this work, because I have a practice too, is I lay out a treatment plan. I explain everything because I'm the expert. I do all of the questions, and the physician actually just okays it, introduces themselves, and I explain to them, this is what we're doing, this is so-and-so, because I'm the expert. He's not, or she's not. I'm the one that's going to be touching them. I'm the one that knows the skin, and I'm the expert, and I think because I work with this person and I'm, being delegated procedures by this person, this is the approval, this is the introduction, this is the, the seal of the deal comes when they come in and Dr. So-and-so, this is how we've always done it. And it works very well because it's super professional. Mm-hmm. And I think when you get somebody that's not, that's more of a patient care coordinator, I think that's great for some things, perhaps, but not for what we do. I think aesthetics is so abstract. It's about your touch. It's about your energy. It's about your connection. It's about your investment in listening to that person yourself, listening to their concerns. And you can't do that secondhand or off a treatment plan. I think it's definitely in the case of, signing up for halos or whatever your scope of practice allows that you will be doing, that you have that contact with the patient. that client. And then you have whatever your state recommends for you to be able to perform that and that introduction. That I think is very, it's just pristine and it works very well.
Well, I think you hit the nail on the head when you talked about the connection and the touch and the feel and the expertise. I mean, look, these procedures are not cheap. There's a lot of competition. You can go to Sephora, you can go to a derm store, you can go anywhere, you can go down the street. I mean, it's funny because the perceived value that we talk about so much is really the truth. People never will care about price. They will typically spend more when they know they're going to get that value. So I really genuinely, admire and respect that. And that's what we believe. How do you what happens when, I'm sure this happens a lot. So for people that kind of are in that sticky space and you're like, oh God, they're not going to buy it. And I don't really want to sell them all these things. How do you go about, is it just really, this is the protocol period? Or what if they're like, well, Shauna, I can't afford that, or I don't really need these products, but yet, I do. Mm-hmm. How do you go about that?
So a lot of times I have tools with me, like I have a book called The Skin Factory, and I have some, visual aids. And I also explain to them, listen, nobody ever told you the reason why your skin is the way it is because you're not doing this. You don't have this in your hands. So in order for us to do anything, you have to start with your retail, because that's the first thing we're going to do. And then I kind of and it's funny because once people start to try something and it works and they believe you because they can see it in you, they can see what you're talking about, they will start to trust you. So trust is the number one thing. Once you gain their trust, and that's through education, that's through expertise, that's through caring because you want to help people, and that's what we're all in here for. So then you say this protocol that I've written for you, I give them a couple of options. This would be, option A, this would be option B. And I try and work with them. I try and give them something that is, that they can, you can see that when they're you can see their eyes light up. So I kind of am a little bit more fluid with that. But basically I have some ideas. And there's a lot of options out there. There's a lot of roads that get to Rome, right? All the roads lead to Rome. So knowing that if they have those essential tools to start with, the right molecules, I can do anything with skin. I can tell you that. That's how confident I am about retail. And it was a perfect question to ask me because it's changed my own career, it's changed my skin. So just getting that right and then developing a treatment protocol with your devices and making something that works with them. And then you have them forever because they're going to rotate around.
No, God, I love this. This was this is exactly how I thought this podcast would go. Again, just having you on here with this knowledge-based. So do you do any clinical training? Like, I'm not saying outside of Derma Concepts, but what if other providers they listened to this podcast and they wanted to reach out to you? Is that something that you do?
Well, that's what my business is. I'm actually a consultant for Derma Concepts. I'm not an employee. And that's what the Institute for Advanced Aesthetics is. And I do go in and I do training because a lot of the master aesthetics people that get out of school and maybe nurses and things like that have never really had to choose settings for devices, or they don't have these things that they're supposed to be learning. There's just like a missing link. So yes, I do that. It's sort of... I'm just out here to change the industry, to make it safer, to make people richer, be happier. It's all because it's so fun. We're doing the funnest job there is. There is nothing more fun than what we do. I can tell you, because it makes people feel good about themselves. And if you can make somebody look at themselves in the mirror and feel good about themselves, what have you done? You know what I mean? That's huge. This is not vanity. This is how people feel about themselves, and that radiates still to the world. When you feel like you have a good hair day, you have a good day. And today's not a good hair day for me, but that's what it is. It's about, and I've seen it over and over and over in patients or clients of mine. And that's why I've become close to so many of them, because guess what? It's such a personal, special thing. And you just want to feel good about yourself. This is what this is about. And we know how to do it. We know what the problem is.
Well, this is what I've always loved about you as a person. And again, why I wanted to have you on here is that there's, to share in the same passion for what is really just bringing value and humbleness and expertise to the industry out of nothing more than pure desire to help people. And I think that is what Terry Ross Consulting was all about. That's what Apex Platform is about. It is nothing more than serving the aesthetic industry at a greater, higher level where the best intentions, and you can't get that from everybody. And if we want practices to go from Groupon coupon type of model, right, to the Four Seasons model. And we know that these women and men are starting to grow at double digits and exponential rates as well. But we know we need to elevate, right? Mediocrity is not going to cut it in this space anymore. It's too competitive. It's too much of a commodity. And I say this often, what's not is you, the provider, the experience, what I walk in, the treatment plan, the shit, you guys, that I swear to God, this is why I'm so passionate and teach everywhere about the consultations that convert, because this isn't optional. It's not optional. And when you know that these products, the right products, can transform skin so that people are looking and feeling their best. I mean, you're right. There's no greater thing than how we feel. So I am so grateful to have you on this podcast. And
it's super fun.
Yeah. It was very fun for me too. So for my tribe, if you guys are interested to learn more, I mean, you see Shauna's desire and passion and you're like, oh my God, I want to learn from her, or I want to learn more about Derma Concepts or more about Environs products, or learn from her clinically. Where can people find you, Shauna? And please tell her that you heard of this from In Touch with Terry, but where can people contact you?
So you can contact me, my email, which is shauna@dermaconcepts.com. And also and I'm not out here to sell my book at all because it's not even done, but that's what my whole book is about. My book is about what took me, 20 years to attain, and it's written through my story, and it's a lot of little technical boxes. So that would be something, and it's called Restoring My Soul. And I thought, that's a terrible name. Why wouldn't you make it something serious, like Revelations of a Revolution of Skincare? But because my soul was restored when I had everything in place and I felt legitimate. I felt like I knew what I was doing. And with every patient, I felt like I had a chance to help them. And so they can email me. And when that comes out, whenever it comes out, hopefully this summer, those are tools just resources that get you to where you need to go next.
Oh, I love that. And listen, I love the name, and I think it's from a humble, beautiful place. So I think that will resonate with so many people versus just some kitschy name. But thank you guys. This was such a great episode. This was all about the value of retail medicine as it relates to sales, the consultation process, more importantly, how it can transform skin and how it can exponentially grow your practice, increase, patient happiness, increase lifetime value. Shauna, thank you so much. I am super jazzed to have you on here. And for you guys listening, I love you all so much. We are almost wrapping up this season. I'm moving on to the next because you guys are just, always in my face, leaving me positive comments, like sharing notes, wanting me to continue this podcast, which is always for you. So thank you so much. And I can't wait to see you on the next episode of In Touch with Terry. Ciao.
Thanks for listening to In Touch with Terry. We invite you to schedule a discovery call with our Apex team. The link to apexplatform.com can be found in the show notes. Thanks again for listening, and we'll see you on the next episode of In Touch with Terry.